Hey everyone, welcome back to Nova Pain and Rehab Center. So today we are going to talk about expecting mothers. We're going to go through some stretches and some mobility that are going to be very common to some of the physical therapy that we recommend to some of the expecting mothers that we treat in the clinic. Now, with most expecting mothers, if you've had any pre-existing back problems, you're probably going to have some back pain. You can't really get away from that, but there are a lot of things you can do to alleviate some of the back pain, and also to actually strengthen your core through your 9 months of pregnancy. So we'll go through some movements today. As I mentioned, all of these may not be great for everyone. So if you're getting into these movements and it's just not working for you, don't push your way through it. Some of these might be a little bit too much, especially as you get into your third trimester. But especially in your first and second trimester, you can do these as much as you need to. If you're having any problems that go beyond this, of course, these are things we definitely specialize in. We treat quite a few expecting mothers in both of our clinics in Arlington and Purcellville. Most of the conditions we treat are very simple. It's just getting the body moving correctly and then going through some education that you can do on your own at home. Okay, so let's get into it. So the first movement we're going to do today is called a cat-cow. This is a very common movement we do in therapy. The purpose is to decompress the thoracic or the mid-back and the low back spine, and also work on stretching some of the muscles in your back, all the way from your neck to your lower back. So let's go through this. So we'll start with the cat movement, all the way up. The goal of this is pushing the back as far as you can up towards the ceiling, making sure you're breathing the whole way through, and then relax. And now we're going to push. Now this one, head up, and I always say try to push your butt up. It's the easiest way to kind of explain to do this. So push your butt up, head up. Okay, you're going to feel that contract and then relax. Breathe in, tuck your chin down, push the shoulder blades all the way up to the ceiling. Hold that for about 3 to 5 seconds, making sure you're breathing, and then come back down. So with this movement, there's not a specific number of reps to do. Usually in the clinic, we will do 8 to 12 of these movements, holding for about 3 to 5 seconds in each position. But just as long as you need until you feel your back open up and release a little bit. Okay. So the next movement we're going to do is called a bridge. And with this movement, the goal is to open up and extend your hip flexors. Now, your hip flexors are going to be very, very tight in almost all expecting mothers. And it's because of the increase in weight, the anterior weight of your baby. And so the hip flexor muscles are going to overcontract in order to create this kind of stability or the support for the excess weight in your belly. So this is going to be pretty universal to most expecting mothers. This is a really, really good stretch to do. So let's bridge up. With this one, you're trying to push your hips all the way to the ceiling, all the way before you can. Now in this position, we're going to do a pelvic tilt. So we're going to tilt the hips down and then tilt the hips up, and then tilt the hips down and then tilt the hips up again. Perfect. Okay. And what this is going to do is going to help to open up and stretch those muscles in the front of your hips. Now we're going to drop the butt down to the floor, flatten the spine, push your belly button to the floor. Okay, this will decompress the spine. Okay, hold that, and then we're going to come up back up in that bridge position and pelvic tilt. So with the pelvic tilt at the top, you can do this usually 2 or 3 times. This is something that it's going to take some practice in doing. This is not an easy movement to do unless you've been doing it for a while. Your brain and your hips are not going to want to work together on this one. But once you get it, it's kind of like riding a bike. It's going to be easy to do. So up, pelvic tilt, back and forth, stretch those hip flexors, back down, and then push your butt down the floor, flatten the spine out. And great. Okay, so that's the bridge with pelvic tilt. The next one we're going to get into is working on activating a stability muscle called your gluteus medius. And this is one of the main stabilizers for your hips. Now your hips are going to start to flatten out a little bit because of, again, the weight coming down on them. And this muscle is universally going to be very, very angry and tight. And so this is a movement you can use to activate the muscle, to get it to fire off a little bit better and to help support your hips. So we're going to use this with and without a TheraBand. So let's use it without the TheraBand. Knees together. We're going to pull that back, knees apart like a clam, as far as you can go, and hold that at the top position. And then you're going to relax back down. Okay, so make sure you have this position first. You're going to feel this in your hip. Okay, and if this is really sore or really tight, this is probably as much as you want to do. All the way back in that clam position, open up, hold that position, really pull that back, and then we'll bring that back down. Okay, so now we're going to use this with a band, and this is going to be, offer some resistance, and you're going to feel this quite a bit more through the hips. So we got this TheraBand loop. We're going to wrap it around the knees, and then we're going to pull that back up just like we did. And you're going to feel it right in that hip area in the gluteus medius muscle. Now, you're going to probably fatigue pretty quickly doing this. And so with this movement, typical suggestion is do as many as you can until you fatigue, until you just can't pull the leg up. Once or twice on each side. 3 times is probably as much as you want to do. By the time you get to the third set, you're not going to have much left. But if you're tight through here, this muscle is going to fatigue rather quickly. Okay. All right, great. So the next one we're going to do a combination, a yoga movement called a child's pose. And this is going to help to open up the latissimus dorsi muscles and stretch the back. Okay, and it's going to keep your belly off the floor. And so with your belly, come forward a little bit. You can take your belly back and sit back on your belly and just really, really push those arms and hands up as far as you can to get a nice stretch through your back and lats. This is going to be a really comfortable stretch to do. And just sit back as far as you can. If you're a little bit later in your pregnancy, you're not going to go back as far. It's okay. So the next variant of this is if you just simply can't go back, you're kind of past that point, we're going to do what we call a prayer stretch. Now, you can use your bed, or you can use a chair or a bench or anything that's a little bit elevated. And we're going to put the hand, same thing on that. And now we're just going to scoot back, and we're going to push the head through the arms. Okay, again, really stretching out the lats, the back. Fantastic stretch to open things up a little bit. Good. Okay. So try both of these and see which one works best for you. They're both fantastic stretches to open up the upper body. If you can't get back, your belly has kind of gotten a little bit too big to move back, and you can get into this position, and both work really, really well. Okay. All right. Excellent. Thank you. Okay. So a couple things that we went through today. Super easy to do, require very little to no equipment. Other than the elastic band, those are really inexpensive and easy to get if you need to. Just a reminder, if you're having consistent pain, these stretches aren't working for you, there's likely some easy, simple, quick things that can be done to get you feeling a lot better. A lot of the pain that expecting mothers experience is just due to the pressure on their back, and that's going to cause the muscles to overengage, become inflamed, and relatively simple things to treat. So don't think that this is something you got to live with. If you'd like to, you can reach our Arlington Clinic at 703-535-8887 and our Purcellville Clinic at 703-376-3797. Hope everyone has a great spring. We'll see you next time.